Welcome all, I am Shrunali, Assistant Manager at Maarga. Today we have with us Dr. Dhruva Aital, who is Lead Consultant Psychiatrist at Maarga. Let us know more from Dr. Dhruva.
I am Dr. Dhruva Aital. I did my MD in Psychiatry at National Institute of Mental Health and Neurosciences, NIMHANS, an institute of national importance, following which I did a fellowship at research from Wellcome Trust DBT India Alliance, and I also have a PhD in brain stimulation among treatment-resistant schizophrenia patients. My interests are chronic treatment-resistant schizophrenia, depression, brain stimulation, addiction. Right now I am heading the addiction specialty at Maarga.
Today, let us know more about addiction. Doctor, can you please tell how a person gets addicted?
Addiction is an unique illness because along with the medical complication that it comes with, it also affects many areas of one's life, like personal, where they fail to perform their duties and responsibilities, social life, where they cut off from their social circle, legal aspects, where they get into troubles because of drink and drive, possessing illegal substances, unwanted behaviors under intoxication, as well as medical problems like having liver failures, whatnot. Previously it was thought it is just the lapse in one's ethical system, and it was stigmatized and people moral police them. But right now we understand it is a biological system in which there are changes in the person's brain which lead to this problem. A person can be at risk to develop addiction at birth because of the genes, and so many environmental factors can also add to this risk, leading to what is known as addiction. There are many substances which can cause addiction, starting from cigarettes to alcohol. There is ganja, also called as cannabis. One can get addicted to opioids, heroin, cocaine, many stimulants, and a lot of other substances. What started initially as, okay, let me try for one high, gradually becomes the life for a person with addiction. They forget to get their social life moving. The substance consumption takes the center stage of their life. They forget to do their roles and responsibilities, get into multiple troubles, and forget their hobbies and many other things. So that is when we call a person is addicted to that particular substance. And leaving it is also not easy because there are these unbearable symptoms like tremors and sleeplessness and confusion in case of alcohol, which keeps this vicious circle going where person continues to use substances.
Doctor, you spoke about multiple addictions like getting addicted to cigarettes, alcohol, cannabis and cocaine. So how does a person come to Maarga and get treated for this?
The de-addiction services initially start with evaluation of a patient. There may be multiple reasons why person is addicted. Some medical reasons like intolerable pain leads to addiction to some opioids. Some psychological problems like I'm too anxious to mingle with people can make them drink and then smoke also at times. So initial part is definitely assessment to know other conditions as well as also what is the level of addiction that the person has for the substance. Following which we will help them get detoxified. As I explained, suddenly stopping some substances can lead to unbearable symptoms. We can medically manage them with the help of medicines. We have round-the-clock nursing service at Maarga who will take care of them and manage each and every symptom that they have under the supervision of the trained doctors in an intensive care setup. Following this would be evaluation of the things that leads a person to have intense urge called as craving for the substance, and we will deal with craving with help of both medicines as well as inputs from psychologists, which is called as craving management techniques. These two, along with for particular substances like opioids, we have opioid substitution therapy, where a harmful opioid like heroin is being substituted by licensed and less harmful medically proven buprenorphine, which is available at Maarga for a particular period of time, from which it is easy for a person to wean off the substance. So these are the initial phases, following which we will continue to also treat other conditions associated with addiction and also make a person confident to lead a life without the help of the substances comfortably. And we will make sure that in the process we will maintain the utmost dignity and the human touch like all our services. Admissions are going to be completely voluntary. None of the time a person would be under a restraint without his wish or will. And all the medicines that we use are going to be evidence proven. So if you find yourself or your loved ones in a problem of drinking, smoking or any other substances, I think this is the time to talk about it with us at Maarga. We would be very happy and also eager to help you with your problem.
Thank you, doctor, for sharing this valuable information. I hope this finds very helpful to you. Thank you.